next one is Mariano
Oh yeah,
Socolovsky.
yes. Oh, sorry. Let me introduce him. Sorry, my mistake.
Hello.
The interview is the last one. Yeah.
Yes.
So yeah, let me introduce you. So we have up next Prof. Mariano Socolovsky from Argentina. He's going to tell us about why neurosurgeons should perform peripheral nerve surgery. So over to you, Professor Mariano.
Thanks, Claire. Let me show my screen. Can you see my screen, my picture?
Yeah. Yes, perfect. Can go to,
Okay.
yeah, great.
Well, first of all, I want to say thanks to Professor Wen, who gave this specialty peripheral nerve surgery a huge space in the neuroanatomical committee, and also Professor Salman Sharif, who did a wonderful sustaining job accompanying us with the big webinars we've been doing for the last year in peripheral nerve surgery. So the question is very simple. Why neurosurgeons should perform peripheral nerve surgery? And we're always dealing with difficult aneurysms or brain tumors, and we as neurosurgeons, maybe we have a big ego and we want to solve big problems that are really important. And some of us can see peripheral nerve surgery as a secondary thing. Let me state this very clearly. Nerve surgery improves, very importantly, the quality of life of our patients. The impact on our patients is very high. And this is the reason to do peripheral nerve surgery. It's a way to recreate, and this is very important, we really recreate completely lost neurological function, which is something that not always, or I would say very rarely, brain and spine surgery can do. And why does peripheral nerve surgery really recreate or restore lost, maybe months ago, neurological function? Because just a simple thing, axons grow and we connect axons, we don't connect neurons. And this is the difference. So this is a good reason to do peripheral nerve surgery. I'm going to show you some examples of this, what I'm saying. This is a real patient. I'm going to take out the sound of the videos that lost his median and ulnar nerves. So no function in the hand, as you can see, only extension, but no flexion. And this is the surgery where we repair with grafts. As you can see, the median nerve, and this is the result. Completely, not completely, I would say, but very, very good recover. And this is some years, the same patient, some years after he was a tattoo maker before the accident. And as you can see, he could recover the function, including opposition of the thumb. So he could go back to his previous shop as tattoo maker. So this is a neuropathy with graft extracted from the sural nerve. And what about brachial plexus injuries? In brachial plexus injuries, we sustain a traction of the brachial plexus by dealing with a lateral displacement of the head and posterior of the shoulder. So we can expect good results in terms of shoulder and elbow flexion recovery. If we have a C5, C6 injury, which is the upper type, before the surgery, the patient will not be able to move the shoulder or to flex the elbow, but this is the final result 3 years after the surgery. And patients with the same lesion, they can really recover really nice and good function. You see there the scars of the incisions of the surgery, but the recovery is very good. And if we are dealing with a complete brachial plexus injury like this one, well, the hand will also be lost because all 5 roots of the brachial plexus will be affected. So if we have a injury here, and we have to expect up to 1 or 2 years in order to recover hand function, so that's not going to happen. And the hand will difficultly be recovered. So this is a complete tragedy. It's a complete amputation of the upper limb. And we can deal with this complete tragedy and regain a lot of function, maybe not the hand, but a good function. And these videos shows a patient with a surgery, brachial plexus injury, complete one surgery. And as you can see, he can do a lot of things like drinking mate, our national beverage here in Argentina, and he can hold things, he can put alcohol in the pandemic time, he can wear a face mask and many other things. He can do a lot of domestic tasks. And I asked this patient in particular to show what can he does with his restored arm, upper limb. And as you can see, a lot of things can be done. So of course, this is not perfection, but this is a very high impact on the function of our patients. So they regain by manual activities. And this is a patient that had a very severe complete brachial plexus injury, and he was 11 years old, and this is the recovered function. But the best present he can give to me as a surgeon is tell me that many times during the day he just forgets about his paralyzed, and you can see here play boxing in the gym. So this is a very high impact. Same goes for instance, hypoglossal facial anastomosis, where we can restore facial function, which is quite important, as you all know, regarding social, functional, laboral, or whatever function you want to refer to. So using the hypoglossal as motor can really improve the function. And you can see on the left side of the screen before the surgery and after the surgery the result of this nerve transfer. It is not always all about trauma of the peripheral nerves. Also compressions like a carpal tunnel or a motor neuroma can give back to the patient a lot of comfort. Patients cannot sleep if they have a carpal compression of the median nerve. So this is a very important surgery for them, and same goes for tumor resection, like this tumor in the hand can be nicely resected and the nerve can be preserved. So this is also a very nice way to be a good doctor, believe me. So certainly, I'm not specially skilled because talent is many times overrated. All the results that you've seen are fully reproducible by any experienced peripheral nerve center, by someone who gets the good training in this specialty. So neurosurgeons should do peripheral nerve surgery because we know how to handle nervous tissue. We born with a microscope in our hands, so we know microsurgery from the beginning, and we perfectly know, of course, how to make neurological physical examination and to understand neurophysiology. Thanks again for your attention.
Thank you. Such a great talk and great results. It's always impressive.
Thank you.
So do you think they always recover, especially the brachial plexus ones? Because we see so many of them, and yeah.
Oh, yes. The question is to do a good timing of the surgery. The surgery is important to be done before 6 months after the trauma. Otherwise, the sequel is going to be bigger.